Okay, summary of the fractures of femur. First of all, let's look at the proximal femur fractures. Now, in proximal femur, we divide it into intracapsular fractures or extracapsular fractures. Now, if the fracture is intracapsular, then we see whether it is displaced or not. If it is not displaced, we simply put a dynamic hip screw. We don't see the age. This is just simple, treatment. But if the fracture is displaced, now we look at the age, whether the patient is an elderly or the patient is a young patient. Now, in a young patient, we do a dynamic hip screw, but we have to do it urgently because displacement has occurred. But in an elderly patient or osteoporotic patient, we don't have a choice. We have to do urgent surgery, hemiarthroplasty or total hip replacement. And now in case of extracapsular fractures, we are going to use a sliding hip screw and plate. We don't consider whether it is displaced or not. Simple one treatment for extracapsular. Now we are going to talk about the subtrochanteric fracture. Now in subtrochanteric fracture of the femur, we use an intramedullary nail, the main option of treatment, or we can use a sliding screw and plate. Okay, these are all MCQs point, and it is a very common SCQ question and essay question. They ask you about the femur fractures. Now the third point is about the shaft. When shaft of the femur is fractured, the blood loss can occur about 1 liter to 1.5 liter. Okay, so this is a problem, and if the bleeding is not controlled, hemorrhagic shock can occur. So what we do in an adult, if an adult comes with a shaft fracture, we use an intramedullary interlocked nail. Okay, same as for subtrochanteric. Now in a child, we use balance traction. Okay, and in an infant, we use a gallows traction, which is also known as a 90-90 traction. These things are not mentioned in Dogar. Okay, so for an infant, we use a gallows traction, which is also known as a 90-90 traction. This 90-90 traction is not mentioned, others are mentioned. Okay, then there is this classification for the fracture of the neck of the femur. They can ask you in the orthopedic ward viva, but this is not mentioned in Dogar, that Gardner's classification. Okay, remember the Gartland classification that was for the supracondylar fracture of humerus. This is the Gardner's classification for the neck of the femur. So we have these 4 stages for it. Stage 1 is incomplete, 2 is complete, 3rd is partially displaced, and 4 is completely displaced. Okay, now the problem that can occur with the fracture of femur, this is an essay question of UHS, that which artery is going to be breached, and we have to which vascular structure is going to be damaged. So superficial femoral artery is the main one. Okay, so whenever there is a suspected injury of superficial femoral artery, we quickly do external fixation and vascular repair must be done right away.